Hello, gentlemen. If you're over 50, 60, or beyond, and something during intimacy has changed, something subtle but deeply unsettling, this message is for you. You feel the full sensation of climax. The pleasure is there. The buildup is there. But when the moment arrives, there's little to no seminal fluid, and instantly, a quiet fear creeps in. Maybe it happened once and you brushed it off, but couldn't stop thinking about it later. Or maybe it's happening more often, and you've kept it to yourself. No one to ask. No one to reassure you. Just silent worry. Let me start by saying this clearly. This is not the end of your masculinity. This is not a sign that your intimate life is over. I'm Dr. Narita, a urologist with 12 years of experience in men's health. And today, we're going to decode what your body is telling you, calmly, clearly, and without shame. Stay with me, because in the next few minutes, you'll understand the real causes, the warning signs you should never ignore, and most importantly, the solutions modern medicine offers. First, a crucial understanding. Climax and ejaculation are not the same thing. Climax is neurological. It's the pleasure response driven by your brain and nervous system. Ejaculation is mechanical. It's the physical release of fluid. Most of your life, they've happened together so seamlessly that you never questioned it. But they are controlled by different systems. When you experience pleasure without fluid release, the medical term is dry ejaculation. You are not broken. Your nerves are still functioning. Your pleasure response is still intact. The change is happening in the delivery system, not your masculinity. The three most common causes. Retrograde ejaculation, the gatekeeper problem. This is the most common cause. Inside your body is a small muscular valve at the bladder opening. During climax, it should close tightly, directing fluid outward. If it stays relaxed, the fluid travels backward into the bladder instead of exiting the body. You still feel climax, but it appears dry. A simple clue. Cloudy urine after intimacy. Common causes include prostate or bladder surgery, certain medications for high blood pressure, medications for enlarged prostate. This is mechanical, not hormonal, not psychological. And in many cases, it can be managed. Duct obstruction, the blocked plumbing. Sometimes the glands produce fluid normally, but the pathway is blocked. Think of it like a pipe with buildup. Possible causes. Scarring from past infections. Untreated prostatitis. Rare small calcifications. Some men notice. Gradually decreasing volume. Mild pelvic discomfort. Thicker consistency over time. The good news. Many obstructions are treatable with medication or minimally invasive procedures. Erone, the fuel problem. Testosterone isn't just about desire. It fuels the prostate and seminal vesicles, the organs responsible for producing most of the fluid. When testosterone drops significantly, fluid volume decreases, libido lowers. Erections may feel less firm. Energy declines. Mood shifts. Muscle mass decreases. This condition, called hypogonadism, is diagnosed with a simple blood test. If confirmed, carefully monitored hormone therapy can restore energy, desire, confidence, and often fluid production. Aging alone is not an explanation. Low testosterone is treatable, when you should see a doctor immediately. Dry ejaculation is usually manageable, but seek urgent evaluation if it appears suddenly with pain, blood in urine or semen, fever, numbness in genital area. These symptoms could signal neurological conditions, uncontrolled diabetes, rare urological cancers. Do not ignore those signs. The emotional reality. This change can hit deeper than most men admit. Many equate fluid with virility. When it disappears, doubt creeps in. You may begin avoiding intimacy, not because desire is gone, but because confidence is shaken. Here's the truth. Pleasure, connection, erection, intimacy, these are not defined by volume. Your body may have changed, but you are not less of a man. The most important step. Information removes fear. Communication restores confidence. And evaluation brings clarity. Dry ejaculation is a medical condition, not a personal failure. Your body is sending a message. Decode it, don't ignore it. And remember, peace of mind begins with understanding. If this conversation helped you, share it with another man who may be silently worrying. You are not alone in this.